Hello, my name is Dr. Nikki Wilson and I am a GP at the Aspen Medical Practice in Gloucestershire. Today we are looking at a presentation called Baby Body Reset, and this has been written for patients that are either trying to get pregnant or thinking about getting pregnant in the near future. For those of you that are already thinking about having a baby, you may have noticed that already everywhere you look there is pregnant people. It can feel really frustrating, especially if you've been trying to get pregnant for a while and it doesn't seem to be happening for you. We need to think about why have we got this epidemic really of women who are struggling to conceive, either due to problems with their own fertility or problems with their partner's fertility. And I think if we look at the environment that we are currently living in and our genetics, there's a little bit of a mismatch. We are, as a population, deficient in nutrients. We're surrounded by toxins coming at us from air pollution, products that we're putting on our bodies, products that we're using in our house. Physically, we are struggling with being less active, increased stress, problems with sleep, and also seeing a rise in patients with hormone imbalances. So this really is an opportunity to think about trying to prepare the body to get pregnant, to get your health as optimal as possible. In the same way that we have birds preparing their nests, or you think about getting that nursery ready in your house, this is a chance to really get your health and well-being the best that it can be and preparing a really good nest in your womb for you and your baby. One of the ways that we can do this are looking at how we can improve and optimize our health. Today we're going to be looking at the 4-pillar approach which the Eat Real Food series advocates, looking at food, movement, sleep, stress. It comes down to basically eating real food and taking care of our own well-being. First of all, think about the environment that we're in. If you or your partner are a smoker, we would really encourage you to think about quitting, and information on this can be found on our website. Fertility services will not accept a referral if you or your partner are smoking. We also know that alcohol can affect our fertility, both sperm production and quality of eggs. So again, if you are drinking more than the recommended limits of more than 2 or 3 units a day, depending on if you're male or female, we would really encourage you to reduce that down and to actually have some alcohol-free days in the week to ensure that your body has a chance to recover and regenerate. Also have a little look at what you're eating. If you're having a lot of very heavily processed food, these will have lots of preservatives and additives added to them. Really want to try and look at keeping the food going into your body as clean as possible, cooking from scratch and avoiding fast food. Also have a think about the products that you're using. Are you using anything that could be very high in toxins? And you'll see in our environmental section on the website there's a really good link to a website called Skin Deep where you can have a look at different products either used in your house or on your body or your hair, and it will tell you the different ingredients and the effect that it can have at your body. What we also know is that when during pregnancy, it's really important that we have optimal levels of folic acid and vitamin D. We recommend that women start to take a pre-pregnancy supplement even before they get pregnant. You should ensure that this contains at least 800 international units of vitamin D or 10 micrograms, and you should have 400 micrograms of folic acid. If there is a family history of spina bifida, or if your BMI is above 30 or you are diabetic or epileptic, it is recommended that you actually have a higher dose of 5 milligrams folic acid, and this may be something that you need to have prescribed for you. So let's go back and think about food. As we've mentioned before, a lot of food that we're eating now is heavily processed. It's got long shelf lives, and to keep the product staying fresh on the shelf, they have to add a lot of preservatives and additives to it. The more a food is processed, the more nutrients are taken out of it. And actually, lots of ready meals or processed things like soups and pasta dishes, they haven't got as much nutrition in them as if you were to make the same dish yourself. Also, as a society, we have been told that we really must eat low fat. However, the problem is that when we eat low fat, it doesn't taste great. So to make it taste better, sugar and artificial sweeteners are added. These sugars and sweeteners push up our blood sugars, and this causes a rise in our insulin levels. Insulin is a hormone that is produced to reduce our blood sugar levels when it gets too high. This insulin also makes us store the sugar as fat. And this high insulin levels can have effect on our hormone levels. So what we want to do is really focus on eating real food. This is food made at home from scratch with real ingredients. Think about what you're going to have as your main ingredient, and then around it put in your vegetables, making sure you're having some healthy fats like olive oil, avocado, oily fish. We would encourage you with dairy to try and go full fat or at least semi-skimmed milk. This is because when we go low fat, often there's a lot of sugar or additives that have been added to make it taste better. Also, some vitamins, particularly things like vitamin A, D and E, are fat soluble, and you actually do need a certain amount of fat in your diet to allow absorption of this. So stay away from your low-fat yogurts that are full of sweeteners and sugar, and instead enjoy full-fat, either natural yogurt or Greek yogurt, adding in some flavour with some berries or fruit. Really good trick is to have a look at the labels on your food. If there is more than 5 ingredients, this is probably a heavily processed food product with a lot of additives and preservatives added to it. Try and avoid those if you can. Try and make sure that you're drinking enough fluid, trying to aim for 2 litres of water a day, and have a think about when you are eating. Try and avoid snacking and stick to your main meals. As human beings, many of us end up with food really interlinked with our emotions, sometimes being used as a crutch. Unfortunately, we don't just eat when we're hungry for most of us. We eat when we're celebrating, we eat when we're sad, we eat when we're stressed, bored, lonely. So the next time you are reaching for that food, really think about doing a bit of an emotional check-in. How are you feeling? Are you really hungry, or is there another need that needs to be met? For most of us, when we eat most foods, this food is broken down into sugar. This sugar level in our bloodstream then dictates to our body when we need to produce levels of a hormone called insulin. When we eat fat and protein, we produce only a small amount of glucose. Carbohydrate-rich foods are essentially chains of sugar stuck together. When we eat these, we push up our bloodstream level of glucose. This causes a spike in insulin to be produced, which helps to take that glucose and store it in the body as an energy source later on. Initially, it will store it in the liver, but once that becomes full, this sugar will then be stored as fat, particularly around a patient's middle. Carbohydrate-rich foods include pasta, bread, crackers, breakfast cereals, sugary foods, and even some starchy vegetables, including potatoes. Some people feel that we can resolve this problem by using artificial sweeteners. However, these common sweeteners fool our body into thinking that sugar is coming. This therefore causes a spike in insulin, even if there is no actual true glucose on its way. This high level of insulin then sabotages any weight loss that we have planned, as we are unable to burn off our fat stores whilst our insulin levels are high. By eating food that is low in sugar or low in carbohydrate and therefore not converted into sugar, we allow our insulin levels to drop. These high levels of insulin affect our sex hormones. A condition called polycystic ovary syndrome is at one end of the spectrum where the insulin levels are very high. This means that although the ovaries are present, they are not able to produce an egg each month. This will often lead to problems with a woman not experiencing a regular cycle and problems with conceiving. By losing weight, it means that these sugar and levels are dropping, the insulin levels are dropping, and we help to have a rebalance of the sex hormones. With polycystic ovaries, often if a woman loses weight, or at least helps to allow their insulin levels to drop, an egg is produced each month. This can then meet a sperm and help to create and sustain a healthy pregnancy. We also know that stress has a big impact on our hormones. Never before have we lived in such a stressful life, particularly at the moment with the pandemic. We are working long hours, we are isolated, more of us are working from home than ever before, we're not as active, we're not sleeping properly, and our levels of cortisol are very high. When these cortisol levels are increased, it makes it harder for us to ovulate and produce an egg each month. This means that sometimes people will skip periods, or they will have a period but an egg won't have been produced. Cortisol doesn't just have an effect on our fertility, it affects our immune system, causes weight gain, people feel tired, they find it difficult to sleep, and it's a really important hormone to get back down into a normal level because it's going to have an adverse effect on all factors of our lives. Ways to try and reduce that cortisol down is to sort of keep moving, and actually that movement in itself is really good because it helps to often promote good sleep, it helps to boost your metabolism. And people tend to feel better in themselves if they've been active. This doesn't mean having to go down the gym or to run a marathon. It can be something as small as going for a walk at lunchtime or after you've had your evening meal. Try and think about some movement snacking. So when you're going somewhere, trying to think about taking the stairs as opposed to the lift, parking furthest away from the door in the supermarket car park, just trying to increase your activity. Now with pedometers and trackers such as Fitbit, and smartphones or connected to your watches, it's really easy to keep an eye on your steps. We would say to aim for around 10,000 steps a day, and you can start off lower than that, and that gives you that bit of that incentive to try and build those levels up. Sometimes people sync in and link in through things like Fitbit or Strava to really compete with their friends or people that they don't know to try and keep themselves moving, and that can be really motivational. Exercise does definitely help too with well-being, and sometimes we can think more about the more gentle types of exercises that are more concentrating on strength and stretching, something like yoga or tai chi. These can also be useful as a form of mindfulness and to try and quieten down that brain that sometimes can just be chattering away and being very distracting. It's also important to try and connect with those that we love and to spend time with people who make us feel better about our lives and ourselves. These people I would describe as radiators. People who are the opposite are hoovers, and I'm sure you all know those people that you spend time with that just suck the fun and the life out of things, out of them. You talk to them about how they are, and it's just a whole wave of negativity that comes out. There's lots of evidence about spending time outside. Some people call it having a nature bath. Part of that is being outside and seeing greenery and just having that space. Also being in daylight helps with our circadian rhythm, which is what our body uses to help generate good sleep. And sleep is a problem, isn't it? Lots of us end up with a sleep debt because we've got so much to do that we're creating a sleep debt by staying up later and getting up earlier. We're working long hours, and that means that we've got less time to enjoy ourselves, and we end up staying late watching something on TV or reading a book. Also, if we're spending more time inside and we're not as active, that in itself means it can be harder for us to sleep. Also, by not being outside, we're not getting that benefit of that daylight and that circadian rhythm. And sleep is really important. If it wasn't important, we wouldn't do it. Evolutionary, we have been designed to sleep, even though probably when we lived in caveman times, it would have made us vulnerable to attack from either other tribes or from predators. That just shows you how important it is. There's lots of evidence behind how sleep allows for cell renewal. It helps reduce inflammation in the body. It allows our cortisol levels to drop down, and it allows us to rest and recharge. So if there's one thing to really focus on is your sleep, because it will have a big impact on how you feel overall. When we're tired, we're more likely to reach for the junk food. We're less likely to want to be active, and we end up in a vicious cycle where we're just really going around dropping our well-being. It's also important to consider about if there is any medication that you are taking at present. Is this going to be okay for you if you're going to try and conceive? It may be that this medication is fine, or it may be that we need to look to change you over to a safer option, or it may be that we need to talk to you about stopping it. Particular medications that can cause problems or that we would want to know about would be if you suffered with high blood pressure, epilepsy, heart disease, kidney disease, thyroid disease, so if you had an underactive or overactive thyroid, inflammatory bowel disease, inflammatory arthritis, or problems with your mental health. That's because some of these conditions can deteriorate during pregnancy. Some of them need to be optimized to help you to conceive, for example, with thyroid disease. And for some, the medication that you're on to control them may need to be reviewed prior to pregnancy. Particularly people that suffer with diabetes, the endocrinologists who are the diabetes specialists at the hospital really want to see these patients before you start to get pregnant. It may be that they need to look at changing over your medication, or they need to make sure that your diabetic control is optimized. We know that during pregnancy, high sugar levels cause an increase in the risk of miscarriage and premature births. It can also lead to congenital abnormalities. So it's really important during pregnancy that your blood sugars are really well controlled and that you are taking really good care of yourself. And by allowing that to happen in the pre-pregnancy state, it really helps to ensure that this pregnancy will be, as you will stay as well as possible during this pregnancy. So are you feeling ready? So the same way that we get your best car seat, the best pram, the best cot, you look at your Which reviews and decide which one you're going to go for. You know, we're prioritizing their safety and their comfort by buying the best car seat that we can. All these things we do for our as yet unborn baby, maybe not even conceived yet baby, these are really important, and you need to give that same level of attention to your own self and your own body. This will give you the best chance of a healthy pregnancy and a healthy baby at the end of it. Thank you for listening. If you've got any concerns about your fertility, we would encourage you to please call the surgery and book a telephone consultation with one of the GPs who will take you through what's been happening and look at any investigations or examinations that need to take place. Thank you.